So the last part of our workshop relies on a very tough task, and that's to try to summarize and make some coherent comments around the day and a half of input that you've gotten. We've asked Dan Kruski from the University of Ottawa and Risk Sciences International to take on that task, and sitting next to him, I've seen that he's been working hard for the last day and a half to do that. So in the next 25 minutes, we're going to get him to summarize what we've all listened to for the last perhaps 24 to 36 hours. So, Dan?
Everything I know is on that screen. So there's two reasons I may have been asked to give the summary. One is because somebody thought I was good at it. I'm sure that's not the reason. The other reason is it keeps me quiet during the meeting, so I'm not being disruptive and obnoxious. Keyboard, turn the slides. How did you do it? So the overarching issues that were discussed at the meeting were, number one, how can we use molecular and systems biology data to inform risk assessment? You've heard a lot about that the last day and a half. Second is how can we actually start to think about operationalizing this new approach using ideas such as value of information? So in day one, we began with a session which introductory comments, first by John Balbus representing NIHS. Their role is to inform risk assessment, not necessarily to do it. So some of the basic science would be within the purview of that organization. John pointed out that he would like to see the science used to inform public health decision making, and also pointed out that because of the complexity of systems biology, which is the focus of this meeting, we're probably going to have to rethink where we're going and how we're going to get there as we move forward. We also had some opening remarks from Isla Cody representing EPA, who was asking the fundamental question, how can molecular biology inform risk assessment? She offered her own thoughts on that later on in the meeting. And when should we do this? Isla was pretty clear. She's ready to go. The next generation of scientists, no pun intended here, is probably well positioned to tackle the new approaches to risk assessment because of their currency in training. And also, Isla was reaching out to other areas, such as the medical community, to see what we can learn from work in the area of personalized medicine. Bill Farland introduced the session on behalf of the standing committee under which this conference is being held. And the committee is designed to facilitate communication between different stakeholders on how to use new types of data for risk assessment. So I think, Bill, we've sort of hit the nail on the head with this session. Explore interfaces between systems biology and risk assessment. That's our overarching goal 1. And also to understand how we would inform decision making, which was goal 2 of the meeting. First presentation, the keynote address by Kim Buckelhide. Kim, are you here?
Yep.
You were instructed to give a definition of systems biology, so I'm reproducing the one that you offered, an interconnected network of events, predictive of emergent properties. We're, as Kim observes, in a time of transformation, understanding more and more about fundamental molecular processes, and trying to see how that understanding can help in the area of risk assessment. The ideal toxicity testing system, that's a nice concept. If you could just sort of have a clean slate and design how you would do toxicity testing. That's what the Committee on Toxicity Testing in the 21st Century had in 2007. But here, some of the attributes would be biology-based, interactive. Certainly, it's going to be complex, and maybe some element of probabilistic outcomes, because getting away from bright lines on safe versus unsafe. We've seen a lot of progress in TT21C since 2007, and Kim was also looking at some of the issues that we need to address as we move forward. Perhaps some of the early implementation of the new science will be in screening and ranking, the high throughput in vitro screens and the structure activity data. But we need to be more systematic as to how we're going to do this. ToxCast may give us some guidance in that regard. In hazard identification, as we get away from animal testing, we'll be moving away from apical endpoints, clinical outcomes in mammalian systems, and looking at perturbations of toxicity pathways. And we want to make sure, as we focus on perturbation avoidance, that we look at enough perturbations that we recover the whole spectrum to represent what could happen in an intact animal. Mode of action analysis was discussed and related to toxicity pathway analysis related to adverse event pathways. And the last point here is the need to distinguish adverse events from non-adverse events. We're going to be able to measure a lot of biological changes with systems biology, but which of those are going to be cause for regulatory concern is a key question. Session 2, where are we going in the area of risk assessment? Lauren gave us a historical perspective, beginning with the 1983 Red Book, which it's amazing that contribution has stood the test of time. The clarity that emerged from sort of lack of any guidance that existed in the early 1980s, some notions that the inference guidelines that have been developed since then were suggested in that report. And even some in 2005, the emergence of precursor biological events in the EPA guidelines for carcinogen risk assessment kind of sort of hints at where we're trying to go at this point in time as we move forward with NextGen. The 2007 toxicity testing in the 21st century put forward the pathway approach toxicity pathway-based approach to risk assessment, which is really systems biology and the terminology discussed at this meeting. The Silver Book, kind of a companion document in many ways, talked about how we should start reorienting risk assessment, maybe to accommodate in part the new types of data, and some new challenges in the area of cumulative risk assessment, where we've seen some progress with phthalates. And Lauren, I noted this last comment here suggested we should take into account concomitant effects of non-chemical stressors. There's a typo there. And I want you to keep that in mind as I show you at the end of the presentation a prototype of the next generation risk assessment framework itself. Continuing the historical development, just some comments which are more current, that risk actually depends on background exposure. We can't just look at the agent administered in isolation. It depends on biological susceptibility as well. And the variation in background as well as endogenous exposures amongst individuals is important when we're considering risks at the population level. And this notion of moving to probabilistic risk assessment, whenever I talk to the media come, they're bright, They want to talk about a risk issue. They don't know a lot about the issue. They're patient, they listen to you, but you know the question that's coming. So is it safe or is it not? And I say, well, it depends. It's not very satisfying. So some sort of way of getting into a probabilistic framework. Very nice presentation from Derek Knight from the European Chemicals Agency, who addressed the question shown at the bottom. How is ECHA thinking about using, their phrase was non-standard information, what our phrase would be systems biology or toxicity pathways or emerging scientific data to fill information gaps. And some of the areas in which ECHA is, well, first we heard a description of what ECHA is about, the life cycle approach to chemical risk assessment, where industry has the major responsibility for establishing safety, submitting dossiers to the REACH program. And part of that, if you're going to use non-standard information, you need to justify its use in your risk assessment. Well, I was surprised to hear that 25% of the data requirements under REACH, and if you look at the REACH documentation, it's very prescriptive. It tells you exactly what you need to submit. A typical dossier would be 1,000 pages long for a high production volume chemical. And 25% of that data seems to be coming from alternative methods such as read across or weight of evidence. Sorry, you can't see the bottom right here. The notion of working towards integrated testing strategies, the Council of Canadian Academies, which is the equivalent of the U.S. National Research Council, did a report in January of this year on integrated testing strategies, and that's the terminology that they've evolved for basically pathway-based risk assessment or next-gen or systems biology. So the notion that Europe is also exploring moving in that direction was quite encouraging. And the various programs, the Accelerate program I knew about, it's kind of coordinating existing activities that are focusing on transition to a toxicity pathway-based paradigm. But some of the other programs, the CIRAT program, which is looking at replacements for repeat dose systemic toxicity testing, I was not aware of. And it looks like there's a lot going on that we can learn from our colleagues in Europe. Isla Cody talked about next-gen possibly providing a paradigm that would allow us to do risk assessment more economically, more quickly. We will never span the universe of 100,000 chemicals within the next 5 centuries if we go at the current rate, so that's one of the major goals of next-gen. There are a number of prototypes that are being conducted. There was sort of a lot of discussion in the panels about how will this work, and these prototypes, I think, as proof of concept, are going to be extremely valuable. And the notion of using different levels of intensity of systems biology in different tiers of chemicals, depending on what your objective is, I think is a very nice aspect of the next-gen concept. So we're going to learn a lot about some of the ongoing activities within EPA, the ToxCast program, which is focusing on a focused series of endpoints, which may allow us to determine which short-term assays are going to be most valuable, which types of QSAR information is going to be most valuable, the possibility of integrating across tissues to capture multiple pathways at the same time. And the zebrafish at the bottom, I think, are a nice reminder that maybe we're not going to do everything in human cells and human cell lines, that some of the more efficient mammalian-based systems may be with us for quite some time. And just some broad observations that Isla made, which I found quite intriguing. As we get more data, maybe we can understand disease fingerprints by looking at various clusters in the data. Diseases would be having a lot in common with toxicity pathways, so really we're looking at one and the same thing. Some joint analyses of old and new data. Many people have asked that be done. And that brought us to section 3, which looked at advancing current risk assessment methodologies using systems biology. Ivan gave us a historical roadmap, and I like this sequence of 5 NRC reports dating back to 1983 with the Red Book. There's a really nice flow as we go to the organizing principles for risk assessment and risk management under Red Book, some thoughts about how to do risk assessment and science and judgment, the new toxicology in TT21C, the Silver Book, updated risk assessment methodologies, the follow-up toxicity pathway meeting. The NRC has really made a huge contribution over a period of time in giving guidance on how to move forward. Ivan also suggested that we think about what we need at the end of the day for decision making, and also to move beyond single stressor assessments. And I don't know, Ivan, if with all these colored books, the Red Book, the Silver Book, were you hoping that somebody was going to write the Gold Book as a consequence of this discussion? And you guys are too quiet. Chie talked about QSAR-21, and I didn't realize the analogy between TT21C and QSAR-21 until I made up the slide last night. But in her presentation, there was a concept of chemical inherency, which looked at the intrinsic chemistry of an agent, interactions with chemical interactions with other agents, how we can predict biological interactions, and exposure, all relating to what we might infer about the risk associated with that agent. So the use of chemoinformatics, quantitative methods in systems biology is very important. And there's a nice database that she's working with that has a large number of compounds of diverse origin. And we saw some very nice patterns starting to emerge. So I think as we look to further analyses of that data, we're going to learn quite a bit about what QSAR can contribute to the future of risk science. Maurice talked about how the paradigm that we use for risk assessment should evolve, and noted that in Europe there are some regulatory actions. The 2013 ban on the use of animals for testing at least cosmetics is going to be a great impetus for moving away from animal testing towards in vitro and other approaches. It's not motivated by sort of the scientific underpinnings of TT21C, but it has the same effect to shift us into a different direction. Other requirements to deal with mixtures in the near term, and the desire on Maurice's part to have some kind of cohesive policy for endocrine a lot of typos in this presentation. Endocrine disruptor legislation, which seems to be appearing in diverse areas within the EU. Systems toxicology was possibly seen as a tool that could help address both the endocrine disruptor challenge, common legislation, as well as non-animal tests. But the key point is the one shown at the bottom. Maurice was encouraging us to move towards more knowledge-driven paradigms, which are built on our understanding of toxicity pathways. And some other points about ECFAM, which is working on alternatives to animal tests. I had not realized that ECFAM was inundated with proposals by different investigators, so that's a sign that there's a lot of activity in this area. The notion that international collaboration is essential for success. When we started talking within the NRC about the 2007 NRC report, I think it even says this in the report, this won't fly unless the international community buys into it. So it's nice to see Canada has been looking at this through the Council of Canadian Academies. Europe has the Accelerate program, a number of things that Maurice described. I've been to China several times in the last 2 years, and this has received a lot of support there. So this international uptake is starting to take place, and as I said, is essential for success of things like NextGen. Justin looked at systems toxicology and cancer risk assessment, looking at a particular case study where we have an agent which causes respiratory irritation, regenerative cell proliferation at high doses, and some mutations and other genetic changes at lower doses that seem to demonstrate a threshold, and trying to integrate all of this information using omics technology to come up with a comprehensive picture of dose response and risk assessment, I think the disappointment that I heard from Justin was not being able to move away clearly from linearity despite all of this understanding of the underlying mechanisms. So could a next-gen approach be applied in general was a question that Dr. Teagarten asked rhetorically at the podium. And some of the requirements would be looking at appropriate cell lines, physiologically normal, where there's some metabolic capacity. A lot of comments we get about going in vitro or how are you going to handle metabolites. And some limitations, possible limitations of the next-gen approach, multiple modes of action, limited coverage of cell types, absence of cell-cell interactions, the most important of which I think is the third one. And as somebody who has given, I don't know how many presentations, and Kim Buckelheit and Mel Anderson, about the TT21C approach, we have heard every criticism that the world could possibly offer at least 15 times. And things like the limited coverage of cell types. With the high throughput capacity we have, it may actually be an advantage because we can cover more cell types than we could in the past with doing a couple of animal species. And Bob Devlin's talk, which I'll get to shortly, offered some encouraging results in that regard right now. So the overall goal here is to see with the ozone as a prototype if we can predict in vivo responses from in vitro data. The nice thing about ozone is we can do controlled clinical exposure studies because we're looking at modest responses, inflammation, not life-threatening, and we can actually get samples of lung tissue to do corresponding in vitro work and see how well things match in vitro and in vivo. And Bob offered a number of examples. I'm going to focus just on one, the characterization of genetic polymorphisms associated with susceptibility to the ozone effects in lung, noting that you could use cultured human cells with different susceptibilities to kind of mimic or to distinguish asthmatics from normal healthy individuals. This is really encouraging because this is actually the rubber hitting the road proof of principle of the type of things we thought would happen, being able to do more to define variability and genetic susceptibility in vitro than we would ever be able to do in vivo. So I think we're headed exactly in the right direction with this line of research. Dean Jones talked about measuring metabolites in plasma and took us back to 1974 when you could do, I thought 1,500 was a huge number, but then when I see 45,000 right about now, very accurately measured, the third bullet says. But if we get to current, the next slide, current potential, something on the order of 500,000 agents simultaneously, I thought was just unbelievable. And the notion of doing metabolome-wide association studies, somewhat analogous to the GWAS studies, to associate specific agents with specific effects, in this case aging in Drosophila, just seems like a whole huge area. You've opened up a whole new universe for us. So I do want to go back one slide and just point out that a lot of this can be used to understand disease etiology, such as Parkinson's disease, but the same technologies will allow us to understand toxicity. I said earlier that mechanisms of disease and toxicity pathways have a lot in common, and that's why I think reaching out to the medical community could be a big plus as we chart the path forward. So day 2, which is today, we started out with a session on value of information. And Greg Pauli gave us a talk to introduce this concept. It was discussed in the Silver Book, emphasized at the problem formulation stage, and you need to think about things that I don't often think about, stopping criteria, when is enough enough? I always think more is better, and Greg constantly reminds me at some point we got to finish the project. The notion of the value of the methods also is quite unique, something I hadn't thought about until I heard about it from Greg. And depending on what data we have, what information we have, what methods we use, decision outcomes could be altered. I suspect most of us are of the mindset that we've got data, we've got methods we're comfortable with. If Bill does it or if I do it, we're going to get the same answer. Maybe that's not quite the case. The definition of value of information is shown at the bottom of the slide, and things that it are, and things that it is, and things that it is not were well discussed by Greg. And the notion of does the data make a difference in the decision is really at the core of value of information analysis. No change in decision, no value to the information. So decision systems analysis and the new omics, is it decision or decisionome? I wasn't quite sure what to put up there. This is your term, but I think it's a good one. And I heard a lot of sympathy from the audience about, yeah, we need to think more about how we're going to make decisions under NextGen, and keep that in mind when I show you the framework as well, because we have thought a little bit about that. The last session, systems approaches in next generation risk assessment. Second last session, sorry, we had our panel. And I just scribbled down some notes. I'm not going to read you, there's 3 pages of these notes. I'll just try and see if there's a couple that I want to mention as I scan through. Third from the bottom, how might we map out decision analysis for NextGen? Without the session that we had on value of information, would that have even come up within in the panel? The last bullet has been discussed in a lot of different guises. How will we know when we're ready to use the new system? How will the system be validated? That was discussed extensively. And I've thought about this a lot. My view is we should not try and validate next-gen systems biology approach to risk assessment against animal models, because what we're really interested in is people. So you'll say, well, I don't have the data to validate in humans, and the answer, and actually Thomas Hartung came to the same conclusion independently of me, and he had it on a slide, which I wanted to ask this question in one of his presentations, and when I saw the slide, he'd already answered it. We need to validate the new approach more holistically by understanding toxicity pathways, mapping toxicity pathways in the same way that we map the human genome, and getting to the point where our understanding is sufficient so that if we prevent this pathway perturbation because we know the mechanism completely enough, we can have confidence that we're going to avoid an adverse health outcome. So that's the kind of validation concept that I've gravitated to, and it took me a year or two to come to that position. Not saying it's necessarily the right one or the only one, but that's just my thinking at this point. More thoughts on validation. The third bullet down, there were several comments that talked about, we should get everybody involved. One of the things that Ayla Cody has done well is reached out to just about everybody on the planet and tried to get them engaged in the NextGen discussion. If you have coffee with her, you'll end up writing a paper for the EPA report on NextGen. And my last slide from this session, I think I will leave for the record and not draw your attention to anything in particular. So the final session was perspectives on EPA's approach to risk assessment. And we had a second panel, equally as powerful as the first panel. I have 5 pages of notes on this group. And the first comment, some skepticism about risk assessment in general, whether it's what we're doing now or what we're going to be doing in the future. But this can be, inside every problem there lies opportunity, and the opportunity here was maybe we can resolve this skepticism by designing a next-gen framework that people have a lot more faith in all sectors. Will NextGen be able to resolve long-standing risk assessment issues such as mixtures? I think it's going to be advantageous simply because of the high throughput. We can test more mixtures, more combinations, more combined exposures. If we're really smart about things like pluripotent stem cells, maybe we can in vitro represent different life stages quite accurately. It may take us a few years, but I see a lot of hope for doing things better on what people have seen as the historical challenges in risk assessment. No specific highlights I want to draw to your attention there. The first bullet here, there's a burden of proof to show that NextGen actually works. We're starting to see in the literature some actual applications. EPA has done some risk assessments on canazoles based strictly on in vitro data and compared them with traditional data. I think those results seem to make good sense. We'll have a series of case study prototypes in the NextGen process itself. So hopefully we'll start to produce the proof that this makes sense as we move forward. Interesting last bullet. Could we have a Wikipedia for toxicity pathways? It wasn't called that, but could everybody who understands a toxicity pathway write it up and give it to Lauren, and we'll put it in the I need a name for this. Which is catchy, simpler than the Wikipedia of toxicity pathways. If you have one, you can give it to me at lunchtime. Interesting last bullet. Can NextGen define a threshold of toxicological concern on molecular grounds as opposed to collecting the world's toxicity data and seeing at what doses we don't see much of a risk across a whole range of compounds? Never occurred to me before. I think it was Maurice who made that comment. So some interesting ideas come out of discussions like this. And the last slide. Maybe the second bullet is the one that I want to focus on, is that success will come incrementally. Maybe we'll understand some toxicity pathways better earlier than others and start using those operationally before we have completely moved away from the current system. So this is a long-term effort, and we're still in the starting phases. So we've talked for a day and a half about the next generation risk assessment framework. Nobody's seen it. Nobody knows what it is. We've had several public dialogue conferences where we've talked about some of the components to it. So I'd like to show you, for the first time in public, what the framework looks like. We have a draft paper, and the thing I want to draw your attention to is version 29. This has gone through extensive review and discussion, and it will go through probably another 10 or 15 iterations before it's done. But I'll just show you the actual paradigm that we're contemplating using. Again, this is draft, and some of the things that it's built on. It's actually built on three cornerstones: the toxicity testing in the 21st century vision that the NRC had produced, and this middle chunk, which Evan actually showed in his presentation. I was quite flattered. It's from a paper that we did in the Annual Review of Public Health last year. It kind of shows how all the new technology, the omics and the structural alerts and the in vitro dosimetry linking to molecular epidemiology in population studies will play out. And it actually fits nicely within the 1983 Red Book paradigm, because we've got hazard ID, dose response, exposure assessment, all leading up into risk characterization. So we're not throwing away the Red Book, we're changing the scientific tools and technologies. So that's this piece here, and that's the TT21C thing. The second thing is new risk assessment methodologies. It's hard to have a schematic of the new methodologies, but you'll see some things like how do we characterize variability, how do we deal with mixtures, the notion of uncertainty is represented here, definition of adversity. So science and decisions is kind of a marker, a placeholder for all the methodologies that we'll need to incorporate here. And the third piece is taking a population health approach, which is something that we've developed at the University of Ottawa, linking the field of population health with the field of risk management. And the idea is your health depends on multiple determinants: social, biological, genetic, health services, lifestyle, and so do health risks. So it's not just a single environmental exposure and a single health outcome. It's the socioeconomic status of the exposed individual, it's the access to health services, it's comorbidities, it's a whole bunch of things. And we'd like to think more broadly about how all of these factors interact. And you may find, in some cases, that it's not the main exposure of interest that offers you the biggest opportunity for risk reduction. It might be a cofactor. A good example is radon and tobacco smoking. 90% of lung cancer due to radon occurs in smokers. If you got rid of smoking, you eliminate the radon problem. I'm not saying smoking cessation is easier than radon mitigation, but it's an example of a powerful lever that you can think of that is not the main exposure of interest. So this is the notion behind the population health approach. And up at the top, we've got some of the main elements that we think should go into decision making: sound risk management principles, cost-effective analyses, risk-benefit analyses, where appropriate, what does the public think, what are the political constraints. And I've actually taxonomized risk management interventions into 5 categories, and I think those are pretty comprehensive. And the notion is maybe we should have multiple interventions to deal with challenging risk management problems. And at the bottom, at the problem formulation stage, there's the emphasis, a la science and decisions, on really thinking about the problem within the risk context, what are your options, and what information is worth getting to solve the problem. So this is one page trying to put the meaning of life on a single piece of paper, but we have a 55-page paper which elaborates a lot of this, which Isla has asked if we could start sharing around publicly within a week or two. So I'm not done yet. I have to thank a lot of people, including the audience who participated, not just the perhaps 50 of you here, but I'm told there have been up to 300 people at any one time on the web listening to this session, so it's obviously attracted a lot of interest. And thanks to those of you who are not here for being present remotely. Also want to thank our sponsors, the U.S. Environmental Protection Agency and the National Institute for Environmental Health Sciences, represented by Isla Cote and John Balbus. They're actually supporting this project and this workshop. Thank our chair for keeping things under control, Bill, very nicely during the session. And I also want to thank the NRC staff who have done a great job in running the meeting very smoothly. And I think we are now officially adjourned.